Another commonly used device for inhaled therapy available in our area is called an Accuhaler. Comes from a particular brand, and I'm going to demonstrate how to correctly use this device. This contains blisters of powdered medication. As with all kinds of inhalers, make sure that you have checked the expiry date and the number of remaining doses. This disc needs to be opened with your thumb in the indentation at one end of the disc. You need to keep turning it till you hear a click. Second, there is a little shelf-like button which needs to be depressed till again you hear a click. This would puncture the blister within the inhaler. There is a mouthpiece through which you need to inhale the medication in a steady and slow inhale breath. As with all inhaled therapy, try and hold your breath for 10 seconds or for as long as you can. Once you've completed your inhalation, you do not need to bring the depressed lever back. Simply close the disc and you would notice the depressing lever would return back to its original position. Remember, you need to listen to 3 clicks. Click number 1, click number 2, and after the inhalation, click number 3 when you close the inhaler. Rinse your mouth or gargle and spit out as with any inhaler containing steroids. If you're in any doubt, please contact your physician. Thank you.